And now she not only walks perfectly, but she jogs and pedals her bike to work every day. So, Dr. Wahls, please tell us about your MS story and healing journey.
Yeah, so during medical school, 1982, I began having electrical zingers in my face that would gradually become more frequent, more severe over the next 20 years. Then in 2000, I developed weakness in my left leg. I see my neurologist and begin the workups. And eventually, I'm diagnosed with relapsing remitting multiple sclerosis. I do my research. I find the best MS center in the country. I take the newest drugs. But 3 years later, at age 48, I'm in the tilt recline wheelchair. And it's very clear that, things are going relentlessly downhill. By age 52, despite taking mitochondrial, a form of chemotherapy, Tysabri, the new biologic agent, I'm in that tilt recline wheelchair. I can no longer sit up. I'm in a zero gravity chair with my knees higher than my nose. Fortunately, I'm still mentally clear, so I'm still staffing the resident clinic. I'm a member of the Institutional Review Board reviewing research protocols. And I tell the IRB I want to review all the brain-related stuff. I'm getting better at reading science, better at reviewing science as it relates to conditions with shrinking brains and spinal cords. I decide that mitochondria are what's driving disability. I create a supplement cocktail for my mitochondria. My fatigue has helped a little bit. I'm immensely grateful. I discover a study using electrical stimulation of muscles. I ask my physical therapist, and we begin testing electrical stimulation. And we add that to my regimen. I discovered the Institute for Functional Medicine. I take their course in neuroprotection. I have a longer list of supplements. And then I have this really big aha. Like, what if I redesign the Paleolithic diet that I've been following already for 5 years based on this long list of supplements I'm taking? So it's a few more months of research figuring out, Melody, where those nutrients are in the food supply. And now in December of 26th, 2007, I start this new way, this highly structured paleo diet. Now at that time, I'm beginning to have brain fog. My trigeminal neuralgia is relentlessly worse. I can take a few steps using 2 walking sticks. Otherwise, I'm in that tilt recline wheelchair. And I'm in a zero gravity chair at work and a zero gravity chair when I'm with my family and taking my meals. I start this new way of eating. I go off to the new clinic I've been assigned, the traumatic brain injury clinic. And the first 2 weeks, I just watch my partners. The third week, I have to start examining patients. And to my amazement, after that first week, I realized I think I can do this. And as a matter of fact, even come home and tell Jackie, I'd like to sit at the table in a regular chair. So we get the regular chair out. I take my meal, and it goes okay. And when I see my physical therapist, he says, Terry, you're definitely getting stronger. And he begins advancing my exercises. I do 10 minutes now twice a day, then 15 minutes twice a day, then 20 minutes twice a day, then 30 minutes twice a day. And then I start walking with walking sticks in the hospital, stunning my colleagues.
Wow.
And then I begin walking with 1 walking stick and then with no walking sticks. And then, on Mother's Day, so really not that long, I'm like 5 months into this. I really want to try riding my bike, which I've not done in 6 years. And so we have this emergency family meeting. My 2 kids who are teenagers, they don't want me to do that because they don't want me to risk falling and, having a major setback. But Jack decides that we can try. We all get in a position. And she tells my 16-year-old boy, 6'5", Zach, you run alongside on the left. Zebby, who's 13, you run alongside on the right, and she'll follow. And we all get in a position, and she gives the all clear. I push off, and I bike around the block. And now that big 16-year-old boy, he's crying. The 13-year-old girl, she's crying. Jackie's crying. And of course, when I relive that moment, tears still come to my eyes, because that's when I realized that the current understanding of progressive multiple sclerosis is incomplete. And who knows how much recovery might be possible. After that, I biked a little bit more every single day. And in October, Jackie comes home and telling me that she signed me up for the Courage Ride, which is 18.5 miles. However
Wow.
far we go will be a triumph. And I have to have several little breaks, but I do make it all 18.5 miles. So once
Amazing.
again,
Amazing.
my kids are crying, Jackie's crying, I'm crying. And this fundamentally transforms how I think about disease and health. It will transform how I practice medicine, and it will transform the research that I do. And I've since made it my mission to teach the public that there is so much that we can do to change the trajectory of our healing journey, regardless of what type of chronic autoimmune or neurodegenerative problem that you've been diagnosed with.
Wow. Well, it's truly inspiring, Dr. Ross. Every time I hear your story, I mean, I get shivers in my whole body. It's amazing. I mean, it's easy to hear it, but for someone who's experiencing it, it's profound.
It,
Changing from wheelchair to bike riding. I mean, this is not
and it was less than a year. It
destiny.
was less than a year. So whoever is listening, whatever your physicians have told you that you have a progressive illness, that there's nothing more that can be done, there are always things under our control that will impact your healing journey. Uh, so please have hope. If I can recover from such profound disability to such a rich and full life that I now enjoy, there's hope for you as well.
Thank you, Dr. Walls. Thank you so much. Dr. Walls, what are the core principles of Wahls Protocol, and how it differs from traditional MS treatments?
So I'll start with traditional MS treatments. There are drugs that are approved that reduce the number of new enhancing lesions, reduce the number of new relapses, and they're actually very effective at that. These new drugs can extend the time that you would have gone from a diagnosis to wheelchair by about 5 years. And so that's profoundly good news for everyone. But you still end up with progressive disability, with cognitive issues, anxiety, depression, brain fog, cognitive decline. And you still end up with this progressive fixed disability that begins to accumulate around age 45 or 35 if you were diagnosed as a child. What's different about the Wahls Protocol is I want you to think of this as an adjunct to whatever disease-modifying treatment that you've elected to do with your specialist. It addresses all the environmental factors that are contributing to the health and vitality of your cells. So it's talking about diet, it's talking about targeted supplements, about sleep, about reducing environmental toxic exposures, about rebalancing your hormones, about adding movement and exercise. And we have helped people address these various domains and the modifiable lifestyle factors at the pace that they can manage, and ideally doing these interventions as a family. Yeah, and I want to remind everyone that in my clinical practice, when I was still at the Veteran Affairs Hospital, I was so successful that we created a new clinic that I ran, the Therapeutic Lifestyle Clinic, and we taught people how to use these concepts. People who were living very humbly, living on food stamps, who had lost their jobs, were disabled, shopping in small rural grocery stores here in rural Iowa, or convenience stores because that's all they had in their little small town. We saw remarkable results, remarkable improvements in quality of life, less pain, more mental clarity, and over time, people could reduce their prescription medication use. So this is the most of the Wahls Protocol concepts you can implement without spending more money. These are modifiable lifestyle factors that are mostly have to do with your choice. And improving the quality of your food at the pace that you and your family can manage is certainly part of that. But much of the modifiable lifestyle factors are parts of our daily choices that will not cost you more money for implementing.
Or in fact, it may cost less money than
It will cost
ultra
less.
processed food are more expensive, probably. Dr. Walls, talking about your research, I always wanted to know, was there an aha moment for you in your health journey that prompted your research in this area?
Well, so when I was first diagnosed, like many physicians, I decided I would begin reading. And what I was reading was very upsetting because I saw the progressive nature of the diagnosis, the rapid loss of employment. So I was just getting more and more wound up. My spouse sat me down and said, honey, you got to stop reading. It's just getting you upset. We'll go find the best MS center in the country and go there. So we did that. I promised I would stop reading, and I just let them take care of me. And so I treated my disease as aggressively as I could, given the reality of 2000 when I was diagnosed. And then when I hit the wheelchair, I was like, okay, I know how bad this is going to be, really bad. Am I doing all that I can? No, because I could still read. So that's when I went back to reading the basic science. And I had already I've been following a low-fat vegetarian diet based on what we'd learned in medical school, that fat's bad, so be low-fat. I thought I was doing exactly the right thing for my health with this low-fat vegetarian diet. And then, reading the basic science, I eventually decided that I should be looking for supplement studies, and I'm reading about all of the neurodegenerative diseases with shrinking brains, shrinking spinal cords. That's where I think mitochondria are the driver of disability. And I create supplement cocktail for my mitochondria. And I find that to be helpful. I'm still doing the low-fat vegetarian diet. My neurologist mentions the work of Ashton Embry, and that leads me to Lauren Cordain and the paleo diet. I read his papers, and after a lot of thought, prayer, meditation, I decided to go back to eating meat. So it takes me several months to reintroduce the meat into my diet. Doesn't really help much, but I figure it might take many months or years for everything to repair itself. But at least I'm doing something, so I'm like, okay, this is what I'll do. It seems to make sense. And then I discover electrical stimulation. I had that. Then I discover functional medicine. They have a really interesting course in neuroprotection. I take that. I have a much longer list of supplements, which I add. Then, I asked myself this really interesting question, and Melody, I laugh at how long it took me to come to this. Like, what if I take this long list of nutrients that I know are important for our mitochondria, figure out where they are in the food supply, and design my paleo diet around these nutrients? And when I do that, that's when the magic happens. It's really stunning. And I should add, there's one more bit here. I had, in the discovery of functional medicine, I decided that I should do a food sensitivity test. And I see that I'm also sensitive to eggs. So I take eggs out of my diet. And I now know that if I have eggs, which I think are delicious, I mean, they're very tasty. I used to love having eggs. It will trigger my trigeminal neuralgia. So, redesign my diet, taking the eggs out, going back to my transcendental meditation, doing electrical stimulation. It's really this comprehensive, multimodal improvement to my self-care routine that leads to this remarkable transformation.
Yes, stress reduction, sleep, and some movements. These are all modifiable lifestyle factors plus diet and lifestyle
Correct.
altogether. I mean, it's just all doable. It's not difficult. It is not difficult.
You know, and so what I want people to do in my practice, we'll talk about, these domains of lifestyle, movement, nutrition, stress management, connection, purpose, our inner aspect, self-talk, and then I'll ask, which domain would you like to work on first? Now,
Mm.
I can give you a plan for all of the domains, and I will. And some of you can do all of the domains at once, but most commonly, we have to pick one domain at a time, get that under a little better control, and then go on to the next domain. And while I might think that diet and nutrition is where you should start, I want you to pick where it is that you want to start. And so many folks do work on nutrition first. Some work on stress first. Some work on movement, or some work on sleep first. It, it People will work most passionately if they get to choose what the domain is that they're going to start with.
One step at a time. Small steps at the end of the month. There are 30 steps.
Yes.
So, Dr. Walsh, regarding your studies and your clinical research, what were what were the most significant findings from your studies on Wahls
Well,
protocol you found?
yeah. So the very first study that we did is it's called a safety and feasibility study. And we were looking at this very complicated regimen that I use for my own recovery. The modified paleo diet, targeted supplements, a mantra-based meditation, electrical stimulation of muscles, and exercise. And we recruited people who were like me, secondary progressive or primary progressive multiple sclerosis. So you anticipate this relentless decline. There's no longer this relapsing, remitting phase. And these people were seriously disabled. They had really significant fatigue. The level of disability was between cane and walker as a group. And so people could implement the diet. 95% of the days, people were following the study diet. They had, I think, on average, 13 minutes of meditation every day. They were able to do their exercise, electrical stimulation of muscles every day. By the end of the study, they're up to 20 minutes of exercise daily and 90 minutes of electrical stimulation daily. So they could do this complicated regimen. It's extraordinary. We didn't know if people, seriously disabled folks, could do this complicated regimen. The answer is yes, they could. The adverse event was if you were overweight or obese, you lost weight without being hungry. That's
It's
a really
awesome.
wonderful
It's awesome.
adverse event, So we'd have to report those changes to my IRB every 6 months. And then the effect size, we had a clinically significant reduction in fatigue, p-value 0.0005, really quite remarkable. We had significant improvements in quality of life. We had significant reduction in anxiety, depression, significant improvements in verbal reasoning, spatial reasoning. And people get worried like, oh my God, you're eating all that meat, you're going to make your cholesterol, go haywire. In fact, total cholesterol goes down, triglycerides go down, the LDL cholesterol goes down, and the good cholesterol, the HDL cholesterol, goes up. And so we kept writing grants to try and do a randomized controlled study of the same intervention. I could not get funding to do that, unfortunately. I could get funding to do diet studies. So then we switched over to doing diet-only studies of the modified paleo diet, and the ketogenic diet. And again, we're able to show that people could implement the diet, lipids changed favorably, fatigue went down, quality of life improved, and hand function, interesting enough, also improved. Then we did a study comparing the low saturated fat diet, known as the SWANK diet, the modified paleo diet, again, also known as the Wahls diet. And we had an observation period, randomized, the two diets. We could show that both the SWANK and the Wahls diet led to reduced fatigue, better quality of life. Wahls was better than SWANK for many of the measures, but not all. The observation period, you got worse. So as no surprise. And now we're doing a study comparing the modified paleo diet and the ketogenic diet to usual diet. People will come in, they will get randomized to one of those three diets. Then they'll come back in 3 months for another check. And then in 24 months, and this study includes MRIs. So we're super excited. We'll see what's happening with brain structure, and we'll have patient-reported outcomes of fatigue, quality of life, mood, and we'll have clinical outcomes of walking, hand, vision, and some working memory. It'll be one of the largest, longest dietary intervention studies that will have been done to date. Melody, we're obtaining saliva and blood so that I'll be able to do some using artificial intelligence, analyze, are there ways for us to predict who would respond well to the ketogenic diet, who would respond well to the paleo diet, based on perhaps their baseline metabolites and their baseline microbiome.
So the saliva
it's very
test,
exciting stuff.
yeah, the saliva test for microbiome.
Yes.
Okay.
And it's a different microbiome in the mouth than in the stool. It's way easier to collect saliva than stool. And so many researchers, including our lab, were switching over to saliva for that reason. So that because what we eat, determines what's in our stool, but it also determines what's in our mouth. It'll give us a lot of information about the health of the microbiome that we have on our skin, in our mouth, in our gut, because we all rely on our microbial friends to help us do the chemistry of life. And if we haven't been good stewards of our microbial friends, we have lost out some of the help. And so by monitoring the microbiome, we'll have a better sense of, do we have the right stewards on board or not?
Wow. So it's exciting to see all these achievements in the science, and the potential advancement in this field is just really,
It is huge.
I mean, huge, huge. Few years ago, if you say somebody from MS restored their health, you wouldn't believe it. I wouldn't believe it. But now MS is easily manageable, controllable, and who knows, maybe in a few years we know about ALS, we know about other ones, and goes on.
We are learning more and more that there is so much that we can do that will impact disease course.
Absolutely. What we are doing to our body, what we are eating, what we are breathing, what we are drinking, all of that, all of that. Dr. Wahls, what is the mechanism of this Wahls protocol that is shifting so the MS, obviously some people have no lesion in the beginning, some people start with one or two and then increases to more lesions, and then spinal cord lesions and all that. So how does Wahls protocol shift these disease cells, disease structures into repair mode?
We understand that the microglia, these are the immune cells in the brain that are responsible for monitoring the environment, killing pathogens, wiping up debris, and they shape and prune the connections between brain cells and shape and repair in the myelin. We know that those microglia will become more agitated, inflamed, destructive if the innate immune system is activated. And we're beginning to realize the innate immune system is either calm or activated based on our modifiable lifestyle factors. So in terms of diet, do you have a diet high in sugar, processed foods, a lot of what we call ultra processed foods with emulsifiers, food additives, stabilizers, etc. Do we have poor sleep? Are we inactive? Are we smoking? Having a lot of exposure to air pollution, water pollution, poor indoor air quality. All of those things will accelerate and amplify activity of the innate immune system. So there's more inflammation in my bloodstream. So I'm going to have more achiness, more pain, more fatigue, more inflammation in my brain. I'll have more enhancing lesions, more relapses. I'll be more likely to have more pain, more sensory problems, more motor problems, more relapses. The disease modifying treatments can block the development of new enhancing lesions, but they don't completely quiet the innate immune system. So you still have anxiety, depression, fatigue, pain, and brain fog. Addressing the self-care routines, helping calm the innate immune system, helping calm the inflammation in your bloodstream, you have less pain, the fatigue is less severe, and you have greater mental clarity. And then the immune cells in the brain are less reactive. So I don't want people to think that I'm advocating this as a replacement for DMTs. That you're gonna have to talk to your personal medical team about how that fits for your care. This is an adjunct, so you have the best possible outcome.
Dr. Wahls, I can attest in my firsthand in my own experience with Wahls Protocol, with your protocol. I used to get a lot of migraine headaches and dizziness very frequently. After getting familiar with your studies, finally, and then read your book, I got the training from you and I eliminated the triggering foods, that the ones that trigger those symptoms in me. And I, amazingly, less than a month, I noticed the frequency and intensity of those headaches are getting less and less and less, to the point that I almost stopped. I mean, yes, if I go to Los Angeles traffic and, bad pollution, I may get headache, but those, I know from external circumstances, not inside of my body. So I believe that ultimately, what is in our plate, what we are doing to our body is the decision maker as far as the health and well-being. We cannot expect to have wrong foods and wrong water and stress, not sleep properly and all that, and have a healthy and optimize our health at all. So this really amazing how these factors can change.
And the more of these modifiable lifestyle factors that we can nudge towards away from disease promoting choices to more health promoting choices, nudge these choices bit by bit towards more health promotion, I think you'll find improvement. And so I've learned to carve out of my day a couple hours in the morning for my self-care routines. So get up at 5:30, do my morning meditation, do my morning workout, take a sauna and a cold shower. And of course, depending on my day, I can spend 2 hours doing that. Some days I have to cut it down to just 15 minutes because my day is so jammed packed. But my wife Jackie will notice that I've let my schedule get a little bit too full. I'm not doing my self-care routines as much, and my face paint is turned on. She goes, honey, I see you've been scheduling some 8 a.m. meetings. You really should not do that before 9 a.m. so you have enough time to do your self-care routines. Because I can occasionally put in an 8 o'clock meeting, but if I start doing it every day of the week, it comes back to bite me. So I've learned that for me, I just do much better if I regularly adhere to my self-care routine.
Dr. Walsh, and also I notice my own experience, when you are in tune with your body, you notice the biosensors talking to you, like telling, don't eat this, don't eat that. I mean, you
Yeah.
feel it, you know it.
Yeah, it's one of the things I teach my clinicians when we go through, we talk about the Wahls behavior change model. And in that, there's a key element of teaching people how to recognize biosensor. For many of us with MS, pain is one of those biosensors. I have trigeminal neuralgia, so I can become aware that the sensation in my face is a little bit different. And then it gets some twinges, and then I start getting electrical, really horrific levels of pain. I tell my patients that, so I had 27 years of worsening trigeminal neuralgia. Now, and suffered a lot. Now I have a different relationship with my trigeminal neuralgia. Now, one of gratitude, because now I realize this is my continuous monitor of the level of inflammation that my microglia are experiencing. If my microglia have no inflammation, my face sensation is normal. If my microglia are getting a little reactive, my facial sensation is not normal and begin to have these twinges. And if my microglia are really inflamed, now I have electrical jolts of really horrific levels of pain. So when that is turning on, I sit down and I look back at the previous 24 hours. What was the trigger? Was it food? Was it stress? Was it toxin exposure? Was it a viral infection? Like nearly always I can identify a trigger and like, okay, how can I avoid that trigger in the future? And I also teach my patients, if you have a great week, it's like, this is the most energy I've had. This is the least amount of sensory disturbance that I've had. My hands are working really, really well this week, much better than usual. I'm not stumbling this week, much, much better than usual. Now I want you to look at, so was what was I doing this week? And I should do more of that because I had such good health. So if we can get tuned in to that awareness of what our triggers are for a poor health day and what our triggers are for a great health week, you can steadily improve your self-care routine and learn what it is that will be helpful for you.
Wonderful, wonderful, wonderful. So you always have to check in with your body and see how you feel, what you
The more
did.
we can learn to pay attention, and you can do this by taking making a little journal,
No.
and you can make this as detailed as you feel like, or as summarized as you want, brief or expanded, and learn. I want my patients, my tribe, my followers to know that you're the principal investigator of the most important experiment of your life, which is your life and how all these exposures are contributing to your health or your disease, depending on the choices and exposures that you're encountering.
Absolutely true. Dr. Voss, what advice would you give to individuals who are struggling with chronic
Well,
illness or autoimmune disease?
the first thing I want you to really think about is, if I can recover from such profound disability, and we've seen others in my clinical trials, in my clinical practice also recover, there is hope for you. And yes, it will take some work. One of the first things that can be very helpful is to imagine if your health could improve just a little bit. What would you like to be doing again with the people that matter to you? Or maybe it's your dog you'd like to take out for a walk again. What would you like to do if your health could improve a little bit? Now you have a palpable goal. And then you can think about, in what domain would you like to work? Nutrition, movement, stress, sleep, relationships. And what would be the small next step that is realistic that you could achieve for an improvement in a health promoting choice in one of those domains? And step by step, nudge from disease promoting towards health promoting. And over the year, wonderful things will happen.
So, what are some actionable steps that you can suggest for
Well,
autoimmune?
so improve your sleep. So many of us are addicted to our phones. Get your phone out of your bedroom so that when you go to bed at the same time every day, get up at the same time every day, keep the phone out of the bedroom. I predict that will improve your sleep. That's not going to cost you anything other than getting the phone away from the phone. And then if you're open to doing some nutrition, I encourage you to think about the ads first. In one of the ads, I really like to have people figure out is how to get more greens into your day. So that might be cooked greens. You could have greens, green grapes, olive oil, and ice and water to make a green smoothie. You and your kids will enjoy that. You could have greens sauteed in some duck fat or ghee. Add a little lime juice when you're done. And that is really quite delicious. If it was not delicious, add just a little bit more fat the next time, and that will make them really quite delicious.
Wonderful, wonderful. Dr. Walls, one piece of advice that you could give to MS patients and autoimmune, just one advice. What would that be?
Think deeply about what it is you want your health for, because that will help motivate you to do this one step at a time and to stay with it.
Yes. And any suggestion for those loved ones of those living with MS, because they are pretty
So,
emotional.
whatever your loved one is, well, first one is if you yourself could begin working on your modifiable lifestyle factors, improving your diet, improving your movement, improving your sleep, so you can lead by example. If your loved one is adopting the Wahls diet, which is really eating more non-starchy vegetables, getting rid of the sugar processed foods, gluten, dairy, preferably also eggs. Do that as a family when you're with that person. That will be super helpful. You could prepare Wahls compliant meals for your loved one and realize that that food can be really quite delicious.
Yes.
That will be super helpful. But be in the journey with the person you love.
That's very precious advice. Thank you. Dr. Voss, are you still coaching patients?
Well,
directly?
I'm no longer seeing patients individually because I'm now a grandmother and I'm reserving time for
Congratulations.
Grandmother Day. I teach people through group programs. And you can find those on my website, terrywalls.com. But if you'd like to have individual patient experiences, now go find a practitioner on my website. And there's a find a practitioner link again at terrywalls.com. We have practitioners, I think, from 29 different countries around the world. We're looking for more practitioners who would like to get trained. So if you're a practitioner with a health license or certificate, please reach out to terrywalls.com certification for training. If you use the code VIP, you have a discounted application fee.
Fantastic, Dr. Walls. Thank you so much for sharing your insights and experiences with us. Your work is making a significant impact in thousands and thousands of lives around the globe every day. And we truly appreciate your passion and dedication to advancing functional medicine and this area of autoimmune disease. If any of you are interested to learn about Dr. Terry Wahls' trials, you can go to terrywalls.com/trials. And you can follow Dr. Wahls on Instagram. She shares wonderful, wonderful, delicious meals She gives you an idea on Instagram, Dr. Terry Wahls, TerryWahls, Dr. Terry Wahls, and on Facebook, Terry Wahls. And so please let us know if you had any questions or comments. Please let us know. Thank you so much, Dr. Wahls.
Thank you.